What do you tell people? What are the key points of why reflexology is awesome?
Okay, so we begin with how the actual program works. So the anatomy piece in the morning, the hands-on in the afternoon. I explain that each class, because it comes its own entity, and so we follow that kind of guide. It becomes what they need it to be. It's a 300-hour program. We look at some charts. We just looked at charts, so that always piques people's curiosity, and how the specific reflex points correlate with the body, the anatomy of the body. And I always like to work on one person during a free talk, someone that has never received reflexology. So that's what we just got done doing. She was amazed. Well, depending on what their needs are, what they're there for, total relaxation and reducing anxiety, those kinds of things are relatively easy. But if somebody's coming to you with a specific problem, shoulders, neck, lower back, hip, maybe recovering from a surgery, so you're doing some pain management, that people are always amazed at how well that can work on those specific areas. Once you put your focus where they need it to be, then you get the results that they need. That's how it works.
Awesome. So relaxation and therapy all at the same time.
Absolutely.
What do other reflexologists do within a hospital setting?
Okay, so 10 years ago was the first time that I was allowed to professionally lay my hands on patients in the hospital. It's an honor and a privilege to be accepted at that level. So training is very important, that you get the proper training that will allow you to be able to go into that level facility. And the universe has just uniquely provided 10 years later, coming full circle. And I'm back at Bacchus Hospital. I'm working on the oncology surgical unit. So these are people of all ages that have just been diagnosed with cancer, and they're there for the surgery piece of their treatment. And then from there, they'll go through radiation, chemotherapy, or possibly both. So I'm working with those patients right now. And from there, I can have other students, certified reflexologists. I can't do this work alone. So the need is real, really real. Right. And so I'm going in and organizing and making these kinds of programs work in these healthcare facilities so that I can bring other students that want their reflexology career to go in this direction. There's plenty of work. There's plenty of work for all of us. So that's my goal, to get it established in a comfortable way and bring the right reflexologist into the facilities. We need more reflexologists, and no matter what direction that you're guided to go in, whether it be a spa setting or a private setting, your own personal practice, it doesn't have to be a medical professional setting, but if that's what you choose for reflexology, there's a great need for you to become part of it. I'd be happy to guide you and bring you into these settings. Yeah. I was so blessed when reflexology found me, because I had thought about incorporating massage or learning a hands-on modality other than the nursing background, doing things on that level. I wanted this holistic piece, and I met a reflexologist. And while all the modalities are wonderful, reflexology can go so many places and touch so many people, where some of the other modalities might not be the right fit. Very rarely is that the case for a reflexologist. Massage deals with muscle and tissue, but we deal with each and every precise point of the anatomy. So if we want to look at the liver or the pancreas or anything, if we want to look at the medial aspect of a brain injury, we can feel the difference. So that is what I think is so unique about reflexology, is because when somebody goes into the hospital and gets a panel of blood work done, and they can describe the symptoms that they're having, and they get the blood work done, and so that there's no solution, that we don't have the answer yet. In Sweden, they will call in a reflexologist, and then she or he might be able to say, have you looked at the pancreas? Because there's an imbalance. There's a blockage. So that's the other unique thing about reflexology.
way faster. I love, obviously, massage therapy too, but I think for
Yeah.
someone like me,
Yeah.
it was a really neat option.
Yeah, and there's all different kinds of touches and the amount of pressure that you can use. There's something called feather touch reflexology, and it gets results just as much as a deep pressure reflexologist will
Right.
get.
Right.
But that's something that you need to learn to adjust your pressure according to the need. Obviously, if I was working on a person like yourself, my pressure would probably be moderate to deep. And with a hospice patient, it would never be moderate to deep. It would only be light pressure and a lot of gentle manipulation, stroking, that kind of therapeutic touch at that point. Yeah. Come be a part of it. We need you.